Well, hello, everybody. We're back on. Hey, welcome to Knowledge is Power Podcast Live. Oh, I caught you off guard, didn't I?
Did.
Hey. We are
I had
back
something in
on.
my mouth.
That's all right. We're back on a Sunday evening. Hey, you know what? We've got a large audience and it's growing per week. And I am just want to be I'm thankful and I'm grateful for those who watches and listens and those who are sharing our podcast. This is the power of the voice that we have in our community. So we're going to empower our community to have the best knowledge and understanding of what we're doing, and that is to educate our community on issues of financial health, money management, local politics, education, the most important education. And I have again, with my guest is Miss Sherry Ulmer, the director of the City of Beaumont Health Department. Sharon, welcome back again, and it is wonderful to have you back. And look like we right back to where we started 3 months ago, right back where we were 3 months ago, and that is COVID-19. And I understand that on Wednesday we had one of the largest peak of COVID-19 viruses recorded. So actually, we were right back to where we were when we first started, and maybe I don't know. I mean, I guess they didn't listen to us the first time, and I understand that this is a serious uh, 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 health virus that we have
It
in this
is.
country, not just this country, this nation. So tell us, Sherry, what's the latest now that's going on here in Beaumont? Because we had the largest peak, the
Yes.
largest numbers of cases. So tell us, the public, tell the community, everywhere, what is going on. I know we started this podcast about 20 minutes ahead of time. So, I used to say a long time ago when we was young, freak come out at night. Well,
Not anymore.
this week got to be in bed by 10. This old freak die.
Oh, yes. Now,
Oh,
if we did this at 5 o'clock in the morning, I'd be right there with you
oh
because I
Lord.
go to bed early, I get up early.
my time. Ooh, Lord, I can't get up that early no more like I used to.
Oh,
But I have to be in bed. I have to be ready. I'm sure
yes.
the world is over with by 9, 10 o'clock.
Oh,
Okay, sure.
absolutely.
Well, tell us what's going on and what's going on in the city of Beaumont.
So actually on Friday, this past Friday, the 26th, we had our largest number of recorded cases since we have entered into the pandemic having hit Beaumont, I guess about 3 months ago. On Friday, we had 59 cases reported to us at the health department.
Wow.
And now we get our numbers from labs and testing facilities. Um, so all of these, by 10 o'clock Friday morning, I think we already had 44 cases. And
Wow.
then by the end of the day, our cutoff time for counting cases is at 3 o'clock because the mayor issues her report at 4 o'clock. So any results that we get after three, those are counted on the next day. But yeah, we had 59 cases, and I don't think that. Well, I know people don't understand what that means for us at the health department. So when we get a result of a positive, we have to notify that person. And a lot of times that's the first time that the person is hearing it. The lab has not contacted the person. So we have to notify that person. We have to do a case investigation. I'm trying to find out if they had any symptoms. What symptoms did they exhibit? Of course, age is a big thing. We want to know their birthday, how old they are, their race. We want to know if they have any underlying medical conditions, whether or not they have traveled out of the city, out of the state, out of the country. So we know now that this virus is community spread. So most of our people are not traveling; they're staying right here in Beaumont. And from that, we also ask them to think about where they have been from the time that we can determine that they've been infectious, or if they're asymptomatic from the time that they tested. We always count back 48 hours because that's the time of them starting to be infectious. And so, contact tracing can be, oh, I don't go anywhere, I don't have any family, I live alone, or it's just my husband. It can go from one or two people up to 20, 30, 40 people that we then have to try to contact. It could be that somebody attended a funeral. Then we have to try and contact people who also were in attendance at that funeral. So, it's not a foolproof system that's in place, but it's what we have to work with at this time. And so we've been fortunate enough to be able to bring on more staff to be able to do this.
It's a lot of work going on, and again, when I said earlier that we must uh, practice being safe.
Yes,
I've been wearing my face mask now for about 3 months since it all started, and not
yes,
because I didn't pay attention to it. It wasn't the style, the fashion style, but I knew that at our age, especially the older age now, that you have to be careful. But now I understand that the younger age group now is being infected by the coronavirus. Is that true?
that is absolutely true. So our average age initially was 49. So we have people in the age range from a few months old up to 94. Prior to Memorial Day, our average age was 49. That average age now is 42. So we do see people younger who are being affected, and um, this is one of the things that we know, that the length of stays for people in the hospital has shortened, for those people who have to be hospitalized. But that length of stay is still 10 to 11 days. So people are still very sick. And I wish that some of the people who have had to suffer through this virus at some point would start to tell their stories, because we have young people 40, 50 with no underlying medical conditions who have had some serious problems. They've thrown clots, they've had strokes, they're having to go through physical therapy because they were in bed for so long. So we're still having people with a lot of um, rehabilitation, a lot of physical therapy that they have to do before they get back to their previous COVID state, or they may never get back to their pre-COVID state. So I really wish that at some point some of them would start telling their stories. I think that we have thought as a community that this was over when things started to open, and we are nowhere near it being open. It is widespread, and the numbers don't lie. Our numbers are increasing every day. So our message is, we really do need for people to be careful, to take it seriously, because it can cause some long lasting health issues if you survive it.
Wow. It,
Yes.
it, yeah, it is really, I really, really know that it is. And, I hear a lot of people just still saying, oh, well, that's just a man-made deal.
Yes.
And it ain't nothing. It's political. And we
Yes.
got to stop that. Just
We
stop it.
have to. We have to. And we get those calls every day. We get those calls every day that, number one, we're either increasing the numbers, like we're just releasing false numbers, or we're either not giving the right numbers. And I'm like, okay, thank you for calling. But one of the biggest issues that we have to deal with is people calling in saying, this is a hoax and you are destroying the economy because this is not real. And how do you reason with that? We're like, Thank you for calling, but I hope that you take this seriously and I hope that you practice safely to prevent yourself from getting the virus.
Yes, and it is a deep. It's really deep. I had a relative of mine out of Houston that
Hmm.
was had to go into quarantine, but I had to go into the hospital because he actually had the COVID-19.
Hmm. Hmm.
And they released him. He was there probably about 2 weeks in the medical center, and he called me on Thursday, and I knew right then that I really had to. You and I, we had to bring this back out again. Is that he was telling me the story what
Hmm.
happened to him, and I wish I could have asked him to come on and let him testify this for someone
Yes.
that really, really had
Yeah.
this particular virus and what he had to go through. And one of the things he did tell me is that for 3 to 4 days, he didn't know where he was. I mean, he didn't know
That's right.
who he was. I mean,
That's right.
he was just that sick. He said he'd never been that sick before in his life.
That's right.
And it's a situation that no one has ever experienced.
Yes.
And one of the things that it made me have this great feeling in me, not the great feeling, but a bad feeling, is that he was telling me the nurses was telling him there was people dying in the hospital and they was alone. They was by
Yes.
themselves. You can't
Yes.
have any visitors. And uh,
Exactly.
yeah, and that's horrible. That's a horrible feeling. You're in
It's
there,
horrible.
you don't have no family, your wife, your spouse, your family, your friend, no one can visit you. You're there all alone.
Yes.
And
That's horrible.
that's
That
horrible.
is horrible. And we tend to think of our numbers of deaths that we've had here in Beaumont. We've had 25 deaths, but those aren't just numbers to us.
Mhm.
Those are people. And yes, some of them were elderly, and yes, some of them were at the nursing homes, but they probably would still be alive if they hadn't gotten COVID. So that affects 25 families who have lost a loved one that they probably weren't able to visit with, especially if they were in a nursing home. Our visitation had stopped in the nursing homes like back in March, I think, early March. So yeah, these are trying times, and there is no way that we can make any of this up. There's no way that we can make it up, and the virus is. I read an article just this week. It said the virus is an unthinking parasite, but it does what it's created to do. It needs humans to survive. So if it has that opportunity, it's going into that human body and it's going for the lungs. It's going to attack the lungs, and it will cost you your life, and we are thinking human beings. So
Mhm.
we have to take a look at what this virus is doing, and it is spreading community wide in everywhere, everywhere. There's not any place that you can go in the United States where it has not affected that area. But we are the thinkers. We have to be able to choose to be responsible, not just for ourselves, but for others around us as well.
You're right, and we have to really think for ourselves first, then
Exactly.
think out for other because, um, right now we've now at the office now we are taking your temperature, forehead temperature when you walk in the door, and we are
Yes.
uh, handing out a face mask, and it is
Yes.
required that they put a face mask on. They don't have one,
Yes. Yes.
and it's because the face mask really is it's for our protection.
It is. It is. If everyone wears a face mask, I read or heard Dr. Fauci say if everyone wears a face mask, it can decrease the transmission by 50%. That's a lot.
That's a lot.
But I just read some recent studies saying if everybody wears a face cloth, it can decrease the transmission to only not by 3%, but it can decrease it up to 3% or down to 3%. So that's really that's effective. If we have that power just to make the decision to put a face mask on, we can see the rates of transmission decrease to 3%.
Mm-hmm.
That's powerful.
Mm-hmm.
That's powerful. And this is from hundreds of studies that have recently been done. So we need to be sure that, if even if we don't want to put it on, if we don't think it's going to work, put it on anyway. Just put it on. It's not going to cause any damage. There are a lot of myths about it will cause you to breathe in your own carbon dioxide. Well, it won't. It's not plastic. It's just a cotton face cloth that we're putting over our nose and mouth. It is just not thick enough to hold in carbon dioxide. So please, please, when you're going out, wear the face mask and practice social distancing.
Yeah, it's true. And use some common sense.
Yes,
It's simple. Just
yes,
I know it's not your style. You never used to wearing something like that over you, but wear your face mask. You don't have to wear the gloves, but wear
yeah,
the
no,
face mask.
no,
The
no,
gloves,
no. You need to wash your hands.
right? Wash your
Yes,
hand. That's it. Because the face,
yes, yes, yes.
the gloves is just as useless as the toilet paper they was buying all over the
That's
place.
right. That's right. Yeah, it's you just yeah, the gloves just really you have the gloves on, and we've seen people they touch everything with the gloves, and then they
Right,
also touch their face with the gloves, and then
right.
they pull the gloves off and they throw the gloves in the shopping cart or in the parking lot of a store, and other people have to come along and pick it up.
But
That's
it's
that's
not. But it most important keeping sanitizer on you. Keep it in your car, in your
that's
pocket,
right.
purse,
I have
whatever,
it everywhere. Yes,
everywhere. I mean, and even if when you pump gas, you need to have
oh
that
yes,
sanitizer. As soon as you finish pumping gas, you need to be wiping your hand with the sanitizer.
exactly.
When you go into the
That's ex-
grocery stores or you pushing a basket, you need to
yes,
sanitize those baskets.
that's right.
And I noticed that when I come home, that damn near have to get undressed because they stripping me. Hey, wait a minute. Well, why are y'all doing that to me this way? You're around with too many people, so we got
That's
to
right.
make sure that you
That's
are
right.
sanitized. And so I picked up groceries one day, and I come in with the groceries, and they stopped me at the door and say, hey, they wiped all the grocery bags down. Everything that was purchased was wiped down with sanitizer. So this
Mhm.
is a new norm now that like we're going to
It's
be
a new
going.
normal. Yes. Yes. We don't see an end in sight to this anytime soon. So it is a new normal. It's something but we can do it. We just have to. We are the thinking beings, so we just have to do it and remind other people to do it. Hopefully, without those people becoming offensive. The judge just this past week passed executed an order that anyone going into a business has to have a mask on. I'm so grateful. I'm so grateful for that. So it kind of puts it on the business, but businesses have signs posted now. Yeah, the only way you
Mhm.
can come in is if you wear a mask. You see that sign when you're entering.
Right.
So and businesses can be fined at least $1,000 or up to $1,000 if someone is in their place of business without a mask on. So they're going to ensure or attempt to ensure that people are entering their business with masks on.
Now that's absolutely correct. You are correct. That is a $1,000 fine. Now I don't
Yes,
know if that is for individuals, but I know
it's
all
for the business.
businesses that
Yes,
you're
it's
not
for the businesses.
right. If you're not uh, uh,
Yes.
obeying the law. That's a law. If you're not
It's
obeying,
a law now.
right, it's a
Yes,
law.
and
It's
it's
ooh,
only in place for a week, but we think that he's going to extend it at the end of that week. So we have to do something. When we chart our numbers of cases, we were at a point where our numbers had flatlined and they were starting to go down. And that's what we were looking for. We were looking for that peak and that plateau and the numbers going down. And we felt like we were in some type of control at that point. Well, then Memorial Day came along. And from the time of Memorial Day till now, those numbers have done a U turn and have skyrocketed.
Yes, it has. Especially the other side. Whew, Lord, I thought we was out of it, but I
Well,
knew.
I thought we were, I thought we had some control over it, and that it was that the numbers were starting to go down, so it was going to. I knew it wouldn't go away, but I thought it was going to be not as serious
Right.
as we knew it could be. Well, we're at that point now where it is as serious. And it's not that we have more numbers because we are testing more people. Of course, that's true. But if we didn't test those people, they would be positive anyway, and they would be infecting the community anyway. So it's better that we know that who those people are, try to get in touch with them, and then try to get in touch with their contacts. Again, this is not foolproof. If this was foolproof 100% and 100% of the time it worked, we could tell people to stay at home and they would stay at home, then we wouldn't have to go through these other issues of these mitigating factors of wearing masks and social distancing. But we are at a point where there's it's this virus is just in the community. It is widespread. There are people who are positive who have not been tested.
Right.
There are asymptomatic people who don't know that they have it. They're not experiencing any symptoms. And do we have some people probably that's positive? They've been told, and they've been told to quarantine, and they're not quarantining. Yeah, probably yes, we do. So that's why it's important that we, the thinking beings, wear the mask, practice social distancing, avoid large crowds. Do not have parties at your home or attend a party at this point. This is not the time. There was just an article this past week about a family in Dallas who had a get together at their home. 18 of those people have ended up testing positive. Two grandparents, the grandmother and the grandfather. And the grandfather was severely ill at the time that the article was released and at the point of needing to go on a ventilator. So now is not the time to attend social gatherings. If you do attend them, they need to be small in number so that you can practice social distancing. But the best advice is just don't do it. It's just don't do it. Now it's not the time.
People, we're warning you right now, and Mrs. Sherry Altman and I, and we had this podcast about 2 months ago, maybe 3 months ago, when this COVID-19 first started.
Hmm.
I had just started doing this podcast because I felt that the need that our community need to be empowered with news and information and knowledge and but we started this deal of 3 months ago, 2 months when COVID-19 started, and a lot of us didn't take it serious. A lot
Yes,
of us didn't. I mean, I took it serious, but I played with it a little bit. So okay, I'll be all right, but I'm gonna do what I'm supposed to do. But
right,
we
right.
didn't take it serious. And now we're back to where we from day one, and we don't know when it's gonna stop and
That's right.
end. And
Yes,
like the only good news about it is that now we have testing, but back then we didn't have testing.
that's right.
So now I'm gonna ask you this on testing: do you think that everybody should be testing if you didn't have it, or you? I'm sure those who feel like they need to should, but
Yes, yes. If you've been a contact, you need to be tested. If you have tested positive before you are released from quarantine, now we're asking that you get two negative tests more than 24 hours apart. Those are the CDC guidelines. So if you test positive, you have been in quarantine and you reach that 14-day um, time period for being released from quarantine, before we release you, we're asking, that's the health department, before the health department will release you from quarantine or give you a letter saying that it's okay for you to go back to work. That's what release means. We're asking that you get two negative tests more than 24 hours apart. So initially, CDC has two guidelines. They have a symptom-based guidelines for people to be released from quarantine, and that is the symptom-based guidelines were really put into effect for communities that did not have access to testing. And so what we did, once somebody tests positive, they go into quarantine, then we would keep up with them. And at that 14-day period, we would call them and ask them, have you had these symptoms? You needed to be symptom free for at least 72 hours before you could be released from quarantine. So, what we found was that if an employer was needing that person or requiring that that person get tested prior to going back to work, a lot of those people were still testing positive, which meant that we had to extend that quarantine. So now we have an adequate amount of testing available. So we're going with a test based strategy from CDC that requires you to have two negative tests more than 24 hours apart prior to being released from quarantine. That's the safest way for us to get people back to work, back in the community.
But I want people to know also as well, if you feel like you are not, you've been in quarantine or you've been have had the virus and you are still testing positive, then I suggest that you do not return to work.
Yeah, you can't. Yeah, if you still test positive, then you stay in quarantine.
Right,
You stay in quarantine.
and also by law that was passed back in March, that you are still going to be paid for not being for having the illness of the virus, and as long as you have documents showing
That's right.
that you've still under the doctor's care on the COVID-19, you
That's
still
right.
get paid. So, people, if you have it or you feel like it, go get tested. And if you have it, stay home, get current
Yes.
quarantine, and just do the right thing because it is not going to help anybody else. You're going to
It's
affect someone else. That person going to go home and affect someone else. And it continues to grow. And it's very important that you listen to
mhm,
the director of the city of Beaumont, health director, Sherry Ullman, and this really, this is her job to inform
mhm.
us, to let us know. And she knows what's going on. She's witnesses what's going on. And I have too, even though I have not been to the hospitals, but I know what's going on. I hear what's going on, and it's really serious. People pay attention,
Mhm.
use common
Mhm.
sense, think for yourself, and make sure that you're protected by covering yourself with a face mask. I don't care if you,
Yes.
I don't care what color it is. I don't care what colors you're wearing. Wear a mask. Wear something over you, and
Yes.
it was
And you can make one. You can get an old T-shirt and cut it and make one. There's instructions on CDC how you can make one. It doesn't have to be something that is expensive, but if everyone is wearing some type of face covering, it can really decrease these transmissions. And let me say this too, Tony. We have a whole another aspect of all of this that I think people don't realize. In As we see these increased numbers of COVID-19, we see our hospitalizations going up, even though the lengths of stay are shorter. It's still 10 to 11 days. So we can actually overwhelm our healthcare system, who, they don't just take care of COVID-19 patients. There's all the other things that continue to go on as well. So we want to be careful, very careful, and very cautious of the fact that if we can do our part, we're also helping decrease the numbers of hospitalizations going to our hospitals so that they can take care of everybody effectively. We hear how Houston's hospitals are overwhelmed to the point where they're admitting their adult patients to Texas Children's. They're running out of beds. We only have so many beds. We only have so many ventilators. We have an adequate amount of beds and ventilators for an average day. But as we see our hospitalizations increase because of COVID-19, it maxes out our ICU beds, as well as the hospitals then have to go into emergency mode. They have to look at discharging people who may not be ready for discharge, but probably can go home and recuperate so that they can move things around. This is, we have a part to play in that. So that's just another point that we need to be aware of when we're going about. Again, if you don't have to go out, make your trips essential only. Wear a face mask, practice social distancing, avoid large crowds, avoid social gatherings. The governor has just closed all bars again. Um, and there's something as, oh, he decreased the numbers of people who can go to restaurants again. We were at 75%. Now he just decreased it back to 50%. Well, there's a lot of places that deliver because we order all the time and they will deliver it to you at your door. Um, or you can do takeout. Just because things are open don't mean that we have to go. We have seen a correlation between Memorial Day, when things started opening up, to now, and we've looked at our numbers increase ever since things opened up. Just because they're open don't mean that you have to go. Practice common sense. Make the decision based on what's best for you and your family. If we start there, then I think we can really take a look at, okay, I'm not only protecting me, my family, but I'm protecting my neighbors, I'm protecting my community. This virus really is a test of our humanity. How do we view our fellow humans, our fellow human beings? We need to be extremely cautious because the virus is doing its part. Now we have to do our part. We're the only ones at this point because there's no vaccine. There's really no therapeutic treatment except for supportive care. If your lungs fill up, you go on a ventilator. If you run fever, well, you get some Tylenol. There is nothing that has been created yet that science has come up with to treat this. So to treat this virus. So we have to be extremely cautious and just practice these public health techniques that have worked for over 100 years now.
Knowledge is power, people.
Mhm.
It is powerful when you get knowledge. This is knowledge you receive, and this is some real knowledge that you need to know and understand that we must take care of ourselves. Now, I'm going to ask the Judge Brannick to come on Tuesday.
Yes.
I can reach out to him. I can get back in touch with him so that he can explain to us the reasons why it was a good reason,
Yes.
and I hope he.
Totally agree with that.
Right, and
Totally agree with that. Yes.
I think 1 week is not enough to mass up. I think it needs to be extended,
Mm,
and I don't know how
I
long,
agree.
but I think we need to because it's not getting any better. So
Yes.
with that, I would like also say that we've how long? Well, let me ask you this before I go into my little spiel about my other shows that's coming on Tuesday, well, I'll stop right there, but come back to it. So if I do, I'm gonna forget what I'm gonna ask you. So since I'm winging it out, I couldn't find my notes, but on Tuesday, on Tuesday, knowledge is power. I'm gonna have a teen um, town hall with the seniors of the class of 2020. I've got a group of young teenagers that just graduated from high school, that want to voice their opinion. They want to express themselves because they want to get involved into the movement, and no one is listening to them. And this is what I mean. I got the call. I said, "Hey guys, don't worry about it. I'm a schedule. I'm gonna move you up into a date that so that you can get your message out. And we need to pay attention to our young people because this is the next generation. And now we've got them involved. They want to be involved in the movement, the Black Lives Matter movement, the 2020, uh, 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 um, what else in 2020 blackout. They want to be involved. They want to get. So this is our future, and let's not ignore them. And let's listen them and listen to them out, and let's see if we can reach out and help them as they get established in the world. And I will have them on Tuesday at 8 o'clock. If you're around, please, you guys share the news. Like my Knowledge is Power podcast page on Facebook and on Describe on YouTube Live. I want to thank my audience that's viewing me and viewing this show at every week, and every week is growing by the thousands. So I thank you, and I thank you for this blessing that I am able to do this with my community. And this is my community. This is the power that we have, so we can express ourselves. We can have knowledge. We can educate you on things that need to be done. Like right now, I have Miss Sherry Ulmer, who is the director of the City of Beaumont Health Department. Oh, and by the way, on Thursday, every first Thursday of each month, I have a roundtable with local individuals that we come on, and we'll talk about local issues or things that we need. Just talking, just having a real good talk about things that's going on in our area, in our local area, in our city. It's going to be on Thursday at 8 o'clock. This is us. We do this once a month, every first Thursday. That's I would have as a guest as attorney Sean Villery. Sammy are going to be with us. He's going to be our guest along with Terry Roy and Chris Jones. So we kind of just chat about what's going on. If you'd like to join us, text me or email your email address, and I will link you in, and you can join the conversation. And Sunday, I'll have a next Sunday is going to be a big show. It's a civil rights movement. We're going to talk about Black Lives Matters and where we're going to go from here. My guest is going to be Dr. Reverend Pastor Delbert Mack and Dr. Reverend Aaron Reynolds, and another special guest, Dr. Terrence Grant Malone out of Houston, will be joining us next Sunday at 7:30. So I'd like you all to join us. We're going to talk about the movement, where we go from here, because the civil rights started out of the church. The pastors, the preachers started. They was the leaders then. So we're going to go back to that, and we're going to dig it up, and we're going to unfold a lot of things, and they're going to unfold a lot of things that we're going to let them lead us, and we're going to just enjoy that. I'm good. Yes, we're going to enjoy that. That podcast is going to be great. Now back to you, Sherry. Now, what do you think if we all, let's say, if we all put a mask on and we kept this mask on, everybody is doing their duties. Mm-hmm. How long do you think that it would take for us to recover and get those numbers down?
That's hard to say at this point because the virus right now is so widespread. We do believe that for every infection that we know about, there's probably between 6 and 24 that we don't know about. So we, but I would like to at least see us, reevaluate. Well, we are evaluating our numbers on a daily basis. So if we start now everybody wearing a mask, everybody avoiding large crowds, practicing social distancing, then I think we could see our numbers start to come down in the next couple months. I think it's so widespread now. We're at a point where we're just out of control.
We're out of control.
The virus is in control. We are not in control. So if we take control, we should see some difference over the next couple months.
Well,
And I know school is starting. I know that there have been practices, I think football practices, basketball practices at the high schools. We've had positive COVID cases at 3 high schools, I think. So, and they've had to stop. Everybody has, they're following the rules, and we appreciate that. But there are decisions being made on how school is going to start in August, I guess.
August.
So we are at a point where we need to see these numbers coming down, I think, before we can make any decision about what is opening. That's my thought. And I don't have the authority
Yeah, I know.
to make those decisions, but like I said, we see the numbers every day. So with the numbers, what they are right now, we still have a lot of work to do.
Yeah, I'm a football addict. I love
I know.
football, and I just can't wait to get football season
I
started. So I
know.
can talk about
Yeah,
the doggone Cowboys,
I know.
how they suck. I mean how good they are, and
I
and
know.
but of course I'm a Houston Texans fan. I go
I
through
know.
So but I can't wait. I started messing with them today, and I realized I said, wait, it's too early. But
Too
I don't
early.
know. We don't know. But basically, we don't know when school's going to start. And I would like to, and I'm probably going to get the superintendents back on again and kind of give us a plan, a tentative plan, because you can't really
Right.
plan because we don't know. I mean, it's going to be hard to think about sending your child to school, and
Hmm.
we don't have we don't have a way to we don't have a help me with that. What I want to say, we don't have nothing
Well, first of
secure.
all, we
We
don't
don't have
have
a
clear cut
vaccine,
knowledge of the virus,
right? We don't have enough,
number one.
right?
Yeah. And then we don't have a clear cut plan.
Well,
So I think it's going to be, I know that people are faced with difficult decisions, with making difficult decisions. But at this point, if we just take a look at what the virus is doing, take a look at the daily numbers, take a look at all the new infections that we're getting, plus the people who are still severely compromised from old infections, then I think that all of that is going to come into play with the right decision being made.
right. Thank you. I was looking at one of the comments. I see Maryland do with sister said that what I wanted to say was no, it's no cure to it or vaccine. That's what I want to say. And
Yes,
did you notice that in Houston, the mayor Turner in Houston just about closed his city back up again,
yes,
and that is close to home. And
yes.
if we don't do what we need to do to prevent it from spreading as much, because we don't know where the hot spots are, right?
Well, right now the hotspots all over. We have numbers of, I mean, sufficient numbers of diseases of the virus in all zip codes.
Wow.
Right now, we've not had any clusters recently, but it's all over. It's all over the city. So it's community spread, which is why it is important for us when we're going out to be safe and avoid going out. If you don't have to, don't go out except for those things that are essential: the grocery store, the doctor's offices. The doctors, our medical staff, they're doing a very good job of attempting to prevent the spread of the disease. Everybody has to wear a mask. It is social distancing in the waiting rooms. Even they
Hmm.
remove chairs out, so you have to sit 6 feet apart. So they're doing their part. Have been very good partners with us um, in working through issues. So we really, really appreciate that. But at the same time, there. I think that we feel that things went back to normal around Memorial Day, and everybody had cabin fever, so they just went out. And we saw the numbers, and when we would see these crowds of people, it's I see people, but I also
Yeah.
see the virus. We're
Yes.
looking at these people and we're like, whoa, this virus.
Yes.
So and from that point, we saw that U-turn and those numbers go up. But every public health person in the United States projected the same thing. They saw the same things that we were seeing is these numbers are going to go back up. This is not a good thing. When restaurants were going from 25% to 50% to 75%, we're like, we're not at a point yet that we should be doing that. But of course, a lot of this is just out of our control as far as making decisions. But we have the numbers, we have the data, and the numbers don't lie. Number one, we're not keeping numbers from anybody, and we're not falsely reporting the numbers. We report what laboratories and hospitals send to us.
So, Sherry, do you think that we have the capacity right now? Because, like you said earlier, that there's other patients that has other types of illness. Do we have the capacity to be able to treat those who have the COVID-19 and those who are just general sick?
So yes, right now our hospitals are doing a good job, but we're seeing some areas and some days where um, it's not just it's not just having the adequate amount of beds or the adequate amount of equipment. You have to have the adequate amount of staff. You have to have those nurses who are trained in providing critical care. So, it's a combination of things. And so they've been taxed. They've been able to do it, but they've been taxed. So we want to keep that in mind. If we can help in any way, we want to be able to help. And we know those ways that we can help in keeping ourselves practicing, aware that the virus is here, aware that it can be serious, and doing what we can do to help prevent the spread.
Yeah, and wash your hands. Wash
Yes,
your hands. Wear your face mask, and also wash your face mask when you're not wearing it. But when you're home,
yes,
wash that face mask because
yes.
it needs to be sanitized as well.
Yes, you
You
can
agree?
wash it, throw it in the washing machine, wash it at the end of every day if you only have
Yes,
one.
yes, yes. I have a sanitizer. I just throw mine in there, but we wash this and throw it in there. Well, matter of fact, I have several face masks now. I have a real
Exactly.
nice, beautiful.
We have wardrobes of
Yeah,
face
yeah. I
masks.
have a real nice, beautiful one I should wear. It's the Houston Texans, and I wear that.
How did I know that?
I know how to get stuff started with you, cowgirl. I'm a Cowboy fan. Hey, listen, here's a question. Here's one question. One of our audience, our viewers is asking: can weddings still take place in Beaumont?
Weddings can take place if um, the crowds, if the attendees can practice social distancing.
Did you hear that? Uh,
So all buildings now, all businesses, uh, I think that, well, no, this is just for restaurants, but each venue has an occupancy number. So a wedding venue, the event center might be certified to have so many people in it, 300 people in it, or 100 people, whatever the number might be. And I don't know if those venues are going to a percentage like the restaurants have. As a matter of fact, the event center here in Beaumont is still not open. It won't be opening until I think the end of July or the 1st of August. But that's based on more than likely what these numbers are going to look like. So you still have to practice social distancing. You have to be safe, and you still have to wear masks.
yes, wear the mask.
Mhm.
I don't care how you do it, just wear the mask.
Just wear the mask. Just wear it.
I've got. How soon you think that we're going to have maybe a cure for this. You hearing reports of it, or a vaccine for it, or
No, no, we don't know when there will be any type of vaccine. We hear that one is being worked on, but we don't know a time frame of when it's going to be.
so we're into this for a while.
Yeah,
And
yeah, we're in for the long haul at this
yeah,
point. So we just need to do it at this point. We just need to do it. I think that if we all pull together as a community, as a nation, and just put those masks on, avoid gatherings, um, that we can make a difference in the numbers that we're seeing, and that's certainly. I mean, New York was able to do it, and they were having you know
yes,
hundreds of thousands of
right.
cases.
Right.
They
But I
were able to
think
do
that
it.
we opened up too soon. Not just only opened it too soon, we didn't have a plan. There wasn't a plan going forward after they released us and said, hey, go outside now, you can go out. But there was no plan. I mean, plan like what we're going to do. We're going to mass up, or we're going to eliminate the restaurants, or what are we going to, what is the plan? So that was no plan. We just threw us out there and we just went berserk. And now the numbers are back up again where they
Right.
once were. So, and it's not the health department. It's more it's more the state has the governor and
Exactly.
the upper folks there who decided to do this did not have a plan, and this is why
Yes.
they're more important. The most thing that was most important to them was the economy, the dollar, in our lives. So now
Yes.
we've got to use common sense and say, "Hey, hold on, we're going to take care of ourselves, and we're going to have to
Exactly.
stop going places that we normally go. We need to stop visiting unless we're going to do some social distancing. If you're going to the grocery store, essential things that you need to do to go to the drugstore to get medicine, things like
Right.
that are essential. But any other, we need to stay back home. We need to get back to where we were in April. And
Yes.
if this thing gets to
That's right.
we can those numbers can flatline and we can
Yes.
slowly come back out again. Then we'll be able to have something to a plan. One if we have a plan.
That's right.
So common sense, folks. Use your wash your hands, face masks, and be very cautious when you stay safe. Mrs. Allman, thank you so much for coming back on
Thank
the
you.
podcast. Knowledge is power, and you have given us some more knowledge. You have educated us on things that we need to know to do, and I include myself into that. And I thank all of the viewers that's watching us. And please share this podcast with your friends, neighbors, loved ones. Just share it all over the place so they can get this valuable information
Yes.
that's important to them, and it help them to know how to live and what to do and what not to do. And go to my new Facebook page, Knowledge is Power Podcast Live, and like it and sign in, and let's keep it going. On Tuesday, day after tomorrow, Tuesday, join us for we having a teen uh, class of 2020 teen town hall, and we're going to have the young people here with us, the young teenagers here, and they want to talk. They want to express what they want to do. They've got a movement. They want to be in the movement. And so
Awesome.
while we've got that fire burning, we want to include them in this and listen to them. So again, Ms. Allman, thank you so much, so much, so much for coming back on.
You're welcome. My
And this
pleasure.
is a power. We're going to keep going. And it's called power. Knowledge is power. Okay. Thank you so much. Love you. God bless. And remember, if God be for us, who can be against us?
Yes.
All good. Thank you so much. Bye-bye.